My name is Ryan Maloney, and I'm the medical director for Erconia. I received my PhD in biochemistry, and I'm one of the co-developers of the Zerona device. The Zerona device is a low-level laser device. What that means, it's a low-energy device that doesn't create a heating effect. There are no side effects associated with such a low energy. A majority of low-level laser technology has been centered around treating wounds and closing non-healing wounds for diabetic patients, so there's a lot of wound healing attributes to low-level laser. What we've been able to determine is that if we target now at Zerona's particular wavelength, 635 nanometers, we can have an impact on your fat-storing cell, known as an adipocyte. We don't collect new adipocytes as we age. Our adipocytes increase in volume, almost 1,000 times their original size. What Zerona can do is it alters the membrane of that cell. Think of the cell as a balloon. When you purchase a balloon, it's small in size. When it accumulates air or helium, it expands in great volume, 1,000 times its original size. The Zerona is the pin that safely and non-invasively can puncture the membrane, deflating the balloon, deflating the fat cell. So what we can do is revert the volume in the cell back to its small, shrunken state so that we have an overall slimming effect in the area that you want targeted or desire to have cosmetically adjusted. So once we liberate the fat, the fatty accumulation enters what is known as interstitial space or extracellular space. Think of this region as the space outside of the cell. Well, that area is highly regulated by what is known as the lymphatic system. The lymphatic system controls the amount of interstitial fluid. So by releasing or liberating the fatty debris, we're ultimately increasing the level of interstitial fluid. So the lymphatic system kicks on. There's a system of vasculature or vessels that pull away from the abdomen and lead towards what are known as sentinel nodes, or the closest lymph node bodies. Lymph nodes contain highly specialized immune cells that are capable of breaking down the fatty debris we've just liberated. So we take this large complex triglyceride molecule we've just released from the cell. The immune cell will actually start to cleave and break down this triglyceride into very basic components, fatty acids and glycerol molecules. So when the lymphatic system finally dumps into our circulatory system, it's not a collection of triglycerides which are unhealthy. It's a collection of fatty acids, which is not unhealthy for the individual. And there's a system in place within the liver that actually targets fatty acids and begins to break down fatty acids safely. This system is known as fatty acid oxidation. It's essentially the breakdown, carbon by carbon, of a fatty acid chain. So what we see is an increase in energy within the liver, an increase of ATP based on the liberation of the triglycerides, which are broken down in our lymph nodes to fatty acids. So the overall process, and which should be a major concern for physicians that don't understand the technology and the Zerona itself, is what are we doing to the cholesterol and triglyceride levels? Well, we had patients endure a non-randomized, non-controlled study analyzing serum triglyceride and serum cholesterol levels. And in 2 weeks' time, we saw no elevation in triglyceride levels, and we saw no elevation in cholesterol. Actually, a significant percentage demonstrated a reduction in both cholesterol and triglyceride levels associated with the Zerona treatment. Whenever a new product enters the market, it's important that the consumer is aware of how the product was tested. And the Zerona endured what is known as a placebo-controlled, randomized, double-blind, multi-site clinical trial. So these are the most important studies that must be performed that look at the true efficacy of a device. And the Zerona has endured this. And patients that participated in our clinical trial demonstrated that after just 6 treatments in 2 weeks' time, we were able to produce a reduction of 3.5 inches in our test subjects, where our placebo group that didn't receive a laser only saw or demonstrated a reduction of only 0.6. So a statistically significant difference between our test group that received Zerona and our placebo that did not receive Zerona. In addition to the benefits that Zerona has cosmetically, there's a benefit there for individuals that have been struggling for overweight and obese status for many, many years, that have been trying and fighting so hard just to get a size reduction in their pants or in their overall BMI reduction. And what it means for me as a biochemist is now we have a tool for these individuals that have been struggling with their weight and with their size for so many years. And we can target these individuals for a period of time, exposing them to Zerona treatment so that they can achieve not just their cosmetic goals, but their health goals. And by treating these individuals that are exceeding 30 BMI, which is obesity, we now have a means to provide them with the motivation necessary, not just to receive Zerona treatments, but make the adjustments in their life so overall they're a healthier individual.